Hi everybody, it's Dr. Magnifico from Jaredsville Vet and Podly.com. This is a video on how to try to get out alive if you end up at an emergency clinic or at a clinic that you feel you cannot afford the price of the cost of the care that they are giving you and your pet is in imminent danger. I am not talking about the vomiting, the diarrhea, the skin, the ear infection, the limping dogs. While those might be an indication for you to consider going to the emergency clinic, those shouldn't be an imminent death is upon you visit. The visits that I'm talking about are the following: the urinary blocked cats, what we call the UOs, those cats that cannot produce urine and therefore have a urinary blockage; the foreign bodies, the dogs that have an intestinal foreign body, which is causing them to, in most cases, vomit and not be able to keep any food down. The concern is that that might perforate and you will, and the contents will spill into your abdomen. The splenectomies, so the dogs that have internal bleeding. The C-sections, which are always on a time crunch. The bloat dogs, like those are the dogs that I'm talking about. Those are the pets that I'm talking about. Those animals that are imminently dying. There are some cases where we got some respiratory distress and some cardiac, but some of those guys are very difficult to treat and have a very poor prognosis. I'm talking about the dogs that will go back to a normal, and the cats that will go back to a normal quality of life and return to a normal quality of life with that immediate interventional emergency care. It used to be 20 years ago that everything was affordable because everyone was taken care of by your general practitioner. Over the last 2 decades, specialty medicine has blossomed, which is a wonderful thing for our profession because now we have lots and lots of treatment options and a much better prognosis for lots of these animals. But the cost of care has absolutely skyrocketed alongside it. There are many days where we get a phone call from somebody who's at the ER. The cost of care is 10 to 20 times what it is at my clinic. Is it the same procedure? Yes. Is it done by the same qualified people? Well, perhaps that's debatable. I am not board certified in anything, but 99.9% of my patients survive after we provide the surgery that they need. And I would say the same statistics are probably the same at all the rest of those general practitioners. We are very skilled. We have been doing these surgeries for a very long time, those of us who have been here for a couple of decades, and we can get these animals out alive for an affordable cost. And in many cases, these people are our clients and we can offer payment plans, which many of the ERs do not. That leaves us in the predicament of what do we do if you end up at 2 o'clock in the morning with a blocked cat or a foreign body. You need to do the following. You need to write down everything that is said to you, every single thing. You can use an app on your phone to do talk to text. You may not in some states be able to video or audio record what's going on, but you can repeat what they're saying. So if I come in the room and say, "Hello, my name's Dr. Magnifico," you can talk to text, "Hello, my name is Dr. Magnifico," and you can transcribe what is going on in that room on your phone. I strongly suggest that you do that. You should record the time that you arrived. You should record everything that is said to any member of the team. You should get their name. Anything that you sign, you immediately ask for a copy, and then you start collecting data. There is a lot of information in data, and there is a lot of ability that you will have in collecting that data. Everything that is given to you, you need to keep a copy of immediately. Before you leave, you should ask for a copy of all of your diagnostics and all of your blood work and anything that was done on your pet. You should always require a written invoice and written estimate invoice, and then go through it line by line. You should ask specifically what part of that is negotiable, and then you should ask for another copy of things that are negotiable. If they say nothing is negotiable, you're probably at the wrong practice and you're probably going to have a very difficult time getting a price that works for you. You also should ask, after you provide your history, you should ask for the differential diagnosis. What do they suspect your pet has? You need to write that down. If they give you multiple, then you need to ask them to narrow it down to the top 3. And then from those top 3, you need to ask which ones are treatable. If they say it's a brain tumor, it's probably not going to be treatable. Most people don't go in and do brain surgery on their pets. If it's something that's end stage, like kidney failure, liver failure, many people can't afford the treatment plan for that. So narrow it down to the things that are treatable. Perhaps it's treatable with antibiotics and some pain meds. or some fluids that will buy you some time to get to another facility. If it's a surgical intervention, then you need to talk about where can you go and what are your options, and then unfortunately you need to do a lot of the legwork on your own. But all of that information that you collect will really help you down the road understand where repercussions might lie, how perhaps you can get your pet some care that might mean the difference between life or death, and then you need to be prepared to negotiate. Most places are not going to negotiate anymore. It is the estimate A. If you cannot produce that, then they are going to send you on your way, which is, in my opinion, an ethical dilemma, because most of us are living by an oath that precludes us to end suffering. That doesn't always mean that euthanasia should be your only option. Unfortunately, these days, it's a very high dollar value, or euthanasia, which in some cases is very expensive. I think a lot of people feel forced to elect that euthanasia because otherwise their dog might die. In some of these cases, these dogs will die if they don't get care, but in a lot of these treatable cases, it's only because you can't find a place that you can afford. If you have a blocked cat, I have a separate video on that, how to negotiate that, but see if you can get your pet through the night, see if you can get transferred somewhere else, and then, more than anything, be prepared before you end up at 2 o'clock in the morning with a blocked cat or a foreign body. You need to have a very good relationship with your veterinarian, and you need to have some place that you can go or someone that you can reach out to try to get care in the interim, or get you some time so that you can get to some place that you can afford care. There are places like Jarrettsville Vet, like Helping Hands, like Spain Now, which is another local clinic, and the Face Foundation. There are multiple places that can get you very affordable surgeries. The difficulty is, can you get there in time, and will your pet survive to get there? Please follow me for the individual diseases and diagnoses, and we can help you try to understand how you might be able to negotiate care so that you can get to a price point that you can afford. Please consider insurance, and please consider an emergency fund, and then please think about supporting practices that are not corporately owned and will give you some flexibility, because we are here to take care of your pets and not our corporate shareholders. Take care, everybody.